Hello everyone, and welcome back to another 10-minute training for the Sana Institute. Today, I'm going to talk about a fairly simple protocol that we all know and we all want to use, but that we can often struggle to translate into practice where sessions are not done daily. Now, this, of course, is vagus nerve stimulation, the topic of my dissertation, something I never shut up about. But stimulating the vagus nerve can do wonders for the body because it has a multifaceted approach, whether that be calming and resetting the nervous system, regulating the digestive system, quelling the fire of inflammation, or even just regulating reflex actions in the body. There's almost always something that the vagus nerve can do. Now, from a therapeutic standpoint, you'd think the ultimate piece would be the anti-inflammatory, so this would be in a clinical setting. But the truth is that in order to obtain that with vagus nerve, you really need sustained vagus nerve stimulation to truly train out a dysfunctional vagus nerve, like especially one that's been chronic for a long time. So why is vagus nerve something we do clinically in that case? Well, it really comes down to the dysregulation of the nervous system. If you've been keeping your finger on the pulse of our Pain Free for Life podcast, you'll have noticed that more and more guests are bringing this to light. When the nervous system is stuck in a traumatic state, you cannot fully heal. The cycle continues and it grows into a snowball effect of full body dysfunction, and the person is just stuck in this chronic loop, getting worse and worse and worse. Now, obviously, there's still that underlying want to stimulate short but sweet sessions, right? It's what we talk about with microcurrent all the time. Less is more. But we really need to be looking to utilize vagus nerve stimulation in a clinical setting where we can. This is a bit trickier, but it can be crucial in resolving chronic conditions. Now, as usual with these trainings, I have prepared a few slides here, just to give you some visual aids and some easy way of reviewing the information without just having to listen to me. So, performing vagus nerve stimulation clinically. So for clinical stimulation of the vagus nerve, you're almost always going to need to break that time rule, the short but sweet. It's a little bit different. Typically, we say less is more, right? 3 minutes is going to be greater than 20 minutes every single time. But with the vagus nerve, it's likely going to be the opposite. We need to engage that nerve and push it to flip the switch so it can hold in this new pattern. The goal is to turn the nervous system around in one fell swoop, so in one session. So how do we do that? So setting the device to 7 to 12 hertz is always going to be essential here. We have to do this. This is the mode we need to use. The next step is to locate that carotid artery, crawl just behind it, and with the power set to a comfortable level, we want to stimulate for a minimum of 3 minutes. Okay? But we're actually treating for change. We want to watch for key changes in the client's body. Stuff that I've noticed and other practitioners have mentioned to me as well could be shoulders relaxing, a deep exhale, a change in tension in the eyes. These things, as subtle as they may seem, represent a total nervous system shift. Most importantly, this is a shift that should last well beyond your single session. Now, we have two versions. I'm going to demo both of these in a second on myself, but we have two versions of this too, because we do have a version for EMF-sensitive people, right? As odd as it may seem, the brush electrode, which we don't use for very many things, is utilized specifically for EMF-sensitive vagus nerve stimulation. Now, this electrode was previously reserved for pets, for the head, for particularly hairy bodies, but now it has a use with the vagus nerve as well. It uses a similar process, the 7 to 12 hertz, locate the carotid artery on the left side, but it involves brushing the nerve down gently over time instead of holding it in place. So again, though, just as with the normal method, we're hunting for that change. We want to find those shifts where people are moving, because then you notice that the nervous system has turned to a different station, essentially. This is what will give you that lasting change that lasts beyond a single session for clients. And yeah, I mean, you can do this on yourself as well. We do talk about this, but you really want to maximize the impact of your sessions on people. And so this is something that can really help to carry that forward. Let's do a little bit of demo here. I do have my Y probe available, connected to one of my evolutions. So essentially at 7 to 12 hertz, you look for that carotid artery. You go just behind it. You place the electrode on that spot. I push in and pull forward, and then I can adjust the power until I feel it. So hold that plus button down, get that jiggle, feel that tingle in the neck. Okay. Now you can wait about 3 minutes for this. This would be the normal time, but you can push that on. Just make sure you keep adjusting the power level to make sure it maintains a comfortable level throughout the therapy for the client. Now, what about the EMF-sensitive version of this? So just to demo this, I have done a video on this one before. I will connect my brush electrode. Now, with the brush electrode, because the needles on here, they're not needles, the pins, I guess, are so small, it's a lot harder to feel the microcurrent. So you want to set the power to where you can feel it. Again, you're still on the left side, and you just want to be feeling for a tingle. It may be that it goes all the way up. Now, I've got a gentle tingle there. Now, you're not going to be looking for that same jiggle, but what you're doing is you're essentially just brushing down the nerve. Almost like you're just petting a cat, right? You just got to be nice and gentle and go down the neck. And you can do this for, again, up to that 20, 30-minute mark you need to do to get them to see that change. You want to see that physical change happen, where you know that they have made a shift. That's the trick. That's the way to do it. So as much as it goes against the typical training of the vagus nerve, realize that utilizing it in this way is working more on that nervous system than the anti-inflammatory. But if that is blocking the healing, if that is creating and fueling the fires of inflammation, then this session, this single session, can make a massive difference. Okay, awesome. I hope you guys found this helpful. I will see you next week for another 10-minute training.